tuning in for our second episode of Hospice Talk with RC Hospice Care. My name is Esther Narcissian. I am the Director of Operations.
I'm Kelsey Murchison, RN, Admissions and Case Manager.
And I'm Tom Rupp, I'm the chaplain.
And I'm DJ Foster, RN Case Manager.
We're here today to tell you a few myths that we've heard throughout the years and, just some, you can say, bad omens around the word hospice.
I could start us off.
Please.
I actually heard one the other day. Someone was asking me if hospice meant, does that mean you're giving up? And I had to explain to them it's not about giving up. It's about choosing a different avenue of healthcare. It's not just strictly end of life and we're pushing to hasten anything. It's treating the symptoms as they arise, but not the underlying condition.
I see.
So, like a hospital, we'll treat the condition, but less on the symptoms. We just have a different goal and
Different
path that we're
approach.
focused.
I love that. It's so funny to me too that they think it hastens death. I think there's a study
There's
on
a proven fact that it extends the life about 27 days.
27 days. So the beauty of it is you get surrounded by people who take care of you during such a difficult time. Any other myths you guys have heard?
I know a big one. Everybody's so scared of morphine.
That's
Everybody's
my
like,
favorite.
oh my God, you're on hospice, so you would give them morphine, right? It's like, no. You give them morphine when they need the symptoms arise. There are so many times that people don't ever take morphine.
I see. And it's not the same type of morphine, right? Like the one in the hospital is different.
No, it is a short-acting liquid medication that you give them in the mouth, even if they can't swallow. So if they're at that point where they can't swallow, it absorbs in the gums.
That's awesome.
So it's just something that makes them comfortable.
And it's only needed whenever the time arises, as
Right.
DJ said.
Yeah, so like shortness of breath or pain. So
Sounds like what you need morphine for.
yeah.
We can give it anywhere. Hospice isn't a specific place. It's wherever the person may be residing. So we go out to different facilities, or it could be at the home that the person has always lived at and delivering care at their bedside.
That's awesome. That's
I remember a myth I've heard, for me as a chaplain, is one of the myths is if you're going to sign up for hospice, that means you're going to die. You're about to die right there that day. And that's, of course, not the case. It could be the case, but by and large, it's not the case at all. It's the beginning of that journey, sure, and it is something now that you're thinking of. It's coming up in the future. I was going to say near future, but we don't know. It could be days, weeks, months, or
Years. We've got someone on there for 10 years.
Yeah.
So
So
long as there's
it's not
a
that
decline.
a myth is, I can't sign up yet. That means I'm about to die today. And
Yeah.
another one, by the way, is the expense. It's too expensive. You know what? That's just a myth. Medicare pays 100%. In fact,
That's right.
all insurances cover hospice 100%. So it's not it's a peace of mind thing.
Definitely.
You don't have to worry about that aspect of it. And I'm sure that's a worry. It's a worry for anybody, but especially if you're facing this kind of thing. Oh, and one more if I can keep talking for a
Please,
second.
please.
Another one is the fact that, there's nothing else that can be done. And that's actually almost like diametrically opposite. No, lots of things are done. Yes, it's a terminal diagnosis, but there's still many different options through the nurse, social worker, chaplain, and others as part of your care. It's expert pain management is what we try and offer.
I love that.
Yeah.
Tom, talking back to the first thing you said about how they're dying right now. It's oftentimes really sad because of this myth, we aren't able to help people longer. Like they only think they need it for the final hours. And I remember I had a patient. Well, I'm not the nurse, but I was there at the admission, where poor family. And granted, they do speak a different language, so it's like they don't even know what benefits they have. As soon as we got there, Kelsey was actually admitting nurse. She did such an amazing job. The family would not stop crying, not just because their loved one was passing and imminent in front of them, but because of the compassion and the care that the nurse was providing to them. And it was so hilarious afterwards. They're like, oh, I'm telling everybody. I'm like, yeah, it's important to educate. And that's the purpose of this video, is to educate you to know that, hey, hospice has so many benefits to it, and here's what it's not about. What other myths have you guys heard about?
another one is, speaking actually, where you said terminal illness. A lot of people think that hospice is just for cancer patients.
I've heard that one.
And it's not.
Yeah.
Yes, cancer is a qualifying diagnosis, but it is not the only thing. Things like COPD, so chronic obstructive pulmonary disease, congestive heart failure, anything that the doctor deems as a terminal diagnosis. And if it runs its course, yes, the idea is it's 6 months. But
as long as there's a steady decline.
As long as there's a steady decline,
yeah,
they can stay on. So.
And people graduate from hospice too. Like,
Yeah.
I think we talked about this last week, where just because you're on hospice, I remember DJ saying this, just because you're on hospice doesn't mean you can never get off of it. At any given time, even if it's the services you don't like of that hospice agency, you have a choice to pick any hospice agency you want, and to even like get assigned a specific nurse. I think what I love about our agency is they hear so many great reviews, and then they're like, oh, can I get this nurse? And thank goodness we're able to accommodate. But I think it's important to be educated in what the benefits entail. Any other myths you guys can think of?
If you don't mind going back to that one, excuse me. I'm sitting here thinking of at least two of our patients. Speaking of, it's not terminal. I mean, it's not immediate, and anyway, what I'm trying to say is we've had a patient I know who did very well under hospice, and did very well for so long that, in his words of his son, he was kicked out of hospice. And I told his son, I said, that's a good thing. I said, it's a good sign. Your dad's healthy, and that's good. We thought maybe that he was terminal. He's not for right now. Now, the cool news about this story is that later on, his dad took a turn, and they came back to us. And that time, it was only a month or so, and before he passed away. But it was excellent. It was an excellent relationship with the family and the patient. That I was going to call it a missed call. We didn't miss it. It's just that
No, people do.
he was fortunate to have more life.
Yeah, and the great thing is, I mean, what I've realized is it's also whenever people aren't around as much when they graduate, loneliness is also a cause for decline, is what I've seen. And some people aren't fortunate to have loved ones and friends next to them or around them during those times, and that's why I think hospice becomes like family. And I know exactly which family you're talking about, and the beauty of it is hospice never goes away. Once family, especially if you choose RC, once our patient, you're with us forever. Even if you graduate, which is awesome, you get extra time, you're always welcome to come back. Whenever we do see that you qualify again, the physicians are on board with it.
I'm glad you brought up families and relationships, because hospice is more than just treating the patient. It's about treating the whole family and everyone involved, all the loved ones in your life. We're there to treat too and take care of as well.
Definitely.
And going back to that part is you never run out of hospice benefit.
I love that.
So, it's not like this is 6 months, that's it, and then it's
and it
over.
used
And
to
that's
be.
how it used to be.
Yeah.
But it's not like that anymore. You can be on it, you can come off, you can go back on. Because some people they think that once you're on hospice, you have to be on hospice, and that's not true. If there's something comes up and they decide, I want to go to the hospital, I want to get treated for that, they're able to be discharged from hospice, go and get treated, do that if that's what they want to do. And at another point in time, they're like, yep, it's time to go back on hospice. Here we are.
Heck yeah.
Give us a call, 916-858-1440.
You know what else makes me laugh? I'm sorry. It reminded me of another myth was as soon as you get on hospice, all your medications stop. And that's it. We're waiting for you to,
Yeah, you have to start morphine,
Yeah.
That's not the case.
If you want to stay on your own medications, that's
You're
fine.
more than welcome to.
We'll cover it. If you want nurse's advice on what you should take and maybe cut out things that may be a little extra, we can help you with that as well.
Like for diabetic patients, when I know that a lot of patients who get on hospice aren't able to eat anymore, there's no need to take your diabetic medication because your sugar isn't elevated anymore. I think it's the opposite at that time, and you don't want to go, there's a word for it, right? They go into like a coma if they end up taking too much of their medication, isn't that correct? So for stopping medications, technically it's a myth, but there is logic behind it, is what we're trying to say. And always stay informed. Ask your nurses, ask your social workers, even ask your physicians on staff or your personal doctors to see which medications should be continued and which ones should be stopped. Yeah.
So don't hesitate to call 916-858-1440 and ask for DJ for a free nursing consultation.
Stop.
And if you you have anything else, please feel free to reach out to us. Thank you so much for tuning in. Look out for the rest of our videos. We have a lot of educational materials. We're letting you know you have a choice, and you should know all the great benefits that are given to you. Thanks.